demonstration of the Hollywood peel. So you're seeing Danielle on camera and our wonderful esthetician extraordinaire, Tonya. Tonya's just turned on the Spectra laser, and I don't know if we can show the laser at all. It's gonna warm up for a second. But it's really foolproof, and I'd like to demonstrate that top hat beam mode that we were talking about. Of course, Danielle, our patient, has already been prepped. Her face has been cleaned before we got started, and the carbon lotion was applied just at the beginning of my talk. So what was that, about 15, 20 minutes that it's been sitting there. You can see that Tonya is adjusting the fluence of the laser. And take the handpiece for me, Tonya, please. And you can see that she's already selected the 8mm spot size on the laser and on the handpiece. As you do that, it changes on the screen. So I've selected 8. It's already recognizing it as being 8 millimeters on the screen. And we have it set first to Spectra mode. So remember, this is the mode. This is the long pulse mode, quasi-long pulse mode. And so Tonya is going to begin creating that thermal heating of the skin. Everybody needs to put their goggles on, please, in the room. Thank you so much. I can hold the vacuum for you if you'd like. So we use the vacuum just to evacuate any little minor smoke that might come. Go ahead and get right down on your skin. You can see that the beam on the handpiece is controlled by this top hat, so it ensures the right size. And Tonya's going to go ahead and get started. So as she goes all over, you'll notice that the carbon lotion is never removed, but we're getting a nice thermal heating of the skin. Okay, how are you feeling, Danielle?
Good.
Good. Any pain?
No.
No pain at all. So this is very easy. And again, something that's so nice to offer, because this is not something that I do. Tonya does this for me. So it's a way to retain patients, and also it generates a nice revenue stream for the practice, and it gives the patients an easy treatment with no downtime. So you can see that Danielle's tolerating this beautifully. It's not painful. She is getting a nice thermal heating all over her skin. Good. Why don't we go to the other side? Well, maybe not finish the whole thing, and then we could switch to the Q switched mode in order to demonstrate removing the, yeah, bring it a little closer. There you go. Good. So again, so easy, no pain, just a few minutes to get the carbon lotion, for the laser to follow the carbon lotion down to the level even of the sebaceous gland. But you'll notice that we are not wiping off the carbon lotion, and we never remove the carbon lotion, as a matter of fact. Very good. Now we're going to switch gears. We're going to switch to the Q switched mode. And Tonya is adjusting the fluence. And with the Q switched mode, go ahead and hit stand by. With the Q switched mode, even though we never wipe off the carbon lotion, as I mentioned, the laser itself removes the lotion. And you can see that the lotion's being removed even though we're not wiping it off. And that's great because it also unclogs the clogged pores, minimizes pore size. Really does a nice job of stimulating that dermal collagen. How are you pain-wise, Danielle?
No pain at all.
No pain at all. So again, this is a great treatment to jumpstart whatever it is that the patient desires, whether it's rejuvenating skin, reducing pigmentation, tightening collagen, if they just want to look fabulous for their wedding, their reunion, their important meeting with the boss, whatever it is that's going on. This is just an easy, effective, fun way. And you can see Tonya is about 2/3 of the way done already. We usually warn people that it's a little bit loud, but it doesn't hurt. Of course, with any Q-switched or long pulsed Nd:YAG, it's important to have protective eyewear. So all of us in the room do have on our protective eyewear because of the pigment that's targeted. So you can see how fast this is. This is easily something that people could come in on their lunch break and get it done, you know, before whatever their important event is or whenever it is that they want to look fantastic. That's basically the entire treatment. Now, one thing that we will do if the patient has some active acne or something that requires immediate attention, we might switch back to the long pulsed mode and go over their acne spots, and that helps to reduce active acne. In fact, because it's so anti-inflammatory, usually takes those pimples down, as well as doing a steroid injection without the risk of atrophy. So that's another big selling point for people. How were you pain-wise, Danielle?
Really no pain at all.
Really no pain at all. You tolerated it beautifully, easy to do. Very good.
Comfortable.
Okay, great.